Did you know I used to have a cooking show? Now, before you start imagining Food Network vibes, let me stop you right there. It was me in my kitchen making dinner live on Facebook. But that little show, it changed how I think about nutrition and client trust forever. Hi, my name is Tanisha Campbell, founder of Enhance Black Women's Health, and I'm a writer, educator, and coach who's committed to advancing health equity and supporting underserved communities, especially Black women. And today we're going to talk about something that you may not even realize could be affecting your clients' outcomes, and that's the words that you use when talking about food. Now, if you're a clinician, a coach, or an educator, this video is going to help you understand how culturally relevant teaching builds trust, avoid language that unintentionally causes harm, and make small but powerful shifts in how you talk about food. So back in the day, when Facebook Live was still popping, I ran a weekly cooking show. Nothing fancy, just me cooking dinner and chatting about meal planning. And one night, a woman named Julia tuned in. Now, she watched one episode and then another and eventually reached out to become a client. Now, here's the kicker. Julia had been following a dozen other health coaches with far more credentials than me, but she chose to work with me because I shared her cultural background. She saw herself in the meals I was making, and I wasn't telling her to cut out the foods that she grew up on. I was showing how to work with them. That's when I realized the way we talk about food either invites people in or pushes them away. It's not always intentional, but in fact, many health professionals have never been trained in culturally relevant teaching. That's why nutrition advice often comes off as rigid, judgmental, or completely disconnected from the client's lived experience. That's why these 3 points matter. Number 1, cultural identity isn't an afterthought, it's the foundation. Julia's meal plan wasn't built around what was trendy or ideal. It was built around her traditions, her lifestyle, and her values. And that's why she stuck with it. Number 2, inclusivity isn't just about representation, it's about respect. Whether or not you share a cultural background with your client, you could still offer care that affirms who they are. That starts with listening and co-creating, not just prescribing. And 3, small language shifts build trust. The words you use around food, like clean, bad, or avoid, can carry shame. Reframing your language opens up space for dialogue, not judgment. Now, if this resonates with you and you want to make your nutrition advice more inclusive, don't forget to like this video, subscribe, and join the EBWH community newsletter so you never miss a conversation on health equity, inclusivity, and culturally responsive wellness. Because the truth is, your words matter more than you think, and when it comes to nutrition, those words can either build bridges or burn them down. Thanks for watching, and I'll see you in the next video.